So let's talk about a pretty fundamental shift in clinical teaching. We're talking about moving from just being the person with all the answers to becoming a guide who helps learners find the answers themselves. We're going to explore how mastering the Socratic method can completely transform the way you teach and help you build residents and students who aren't just full of facts, but are sharper, more independent, critical thinkers. You know, the kind of doctors we need. Okay, so here's the game plan. First, we'll nail down what the Socratic method actually is. Then, we'll talk about the absolute non-negotiable foundation, psychological safety. After that, we'll walk through a simple 5-step technique, see how it works in the real world, both on the wards and in the clinic, and we'll wrap up with some pro tips to really master the art of asking great questions. All right, first things first. When you hear Socratic questioning in medicine, I know where a lot of our minds go. Pimping. You know, that rapid-fire, high-stress quizzing. But let's be super clear, that is not what we're talking about today. The true Socratic method is something way more thoughtful, way more collaborative. It's a huge challenge, right? You're in a busy clinic, you're on rounds, and you're trying to teach not just facts, but the process of clinical reasoning itself. How do you do that effectively? Is there a better way than just giving a lecture or firing off random questions? Well, of course there is.
So, what is the Socratic method, really? At its heart, think of it less like a test and more like a collaborative investigation. It's a structured conversation where the real goal isn't just getting the right answer, but uncovering the path to that answer. It's about building up the learner's own thinking process so they can figure things out on their own long after you're gone.
Now, here's the thing. Before you ask a single Socratic question, you have to get the environment right. None of this works if your learners are terrified of being wrong. So the absolute foundation for this entire technique is something called psychological safety. And this definition just nails it. Psychological safety is that core belief that you can try something, you can throw an idea out there, you can ask a question or even make a mistake, and you won't get punished or humiliated for it. It's the freedom to say, I think it might be this, but I'm not totally sure why, without fear. If you don't have that, people just shut down. Game over. And this isn't magic. You have to build this environment on purpose. You can do it by actively inviting them to speak up. Maybe saying something like, hey, what are your initial thoughts? Even if they're half-baked. You can also show your own fallibility. Admit when you're not sure about something. The whole goal is to make speaking up feel way less risky than just staying quiet. All right, so you've created that safe space. Now we can get into the nuts and bolts of the technique. Once that safety is there, you can use this practical 5-step method for your Socratic teaching. And here's the framework. It's so simple, but so powerful. 1, you ask a really good, thought-provoking question. 2, and this is probably the hardest part, you wait. You just let them think. 3, if they're stuck, you don't give them the answer. You just nudge them with a smaller, guiding question. 4, you grab what they said, summarize it to lock in the learning, and then, you guessed it, you start the cycle all over again, building on what they've just figured out. Okay, theory is great, but let's get real. What does this actually look like during a crazy busy day? Let's take a look at 2 super common scenarios, inpatient rounds and a typical outpatient clinic visit. So we'll walk through 2 different dialogues. On the left, we've got a classic inpatient case, a patient with edema in both legs. And on the right, we'll switch gears to an outpatient setting with a kid who has knee pain. Okay, let's break down this inpatient case. Instead of asking what causes edema, you start bigger. What's your problem representation? That forces them to pull all the data together into one sentence. From there, you guide them. Okay, based on that summary, what are your top 3 differentials? Then you make them dig into the data. Which finding points more to cardiac failure than renal failure? Now they're weighing evidence, not just listing things. And finally, that crucial last step. Is there anything here that doesn't quite fit with your number 1 diagnosis? That teaches them to challenge their own thinking. Now let's jump over to the clinic. For the child with knee pain, you could ask, what parts of the history are making you think this could be inflammatory? This connects their thinking directly to the patient's story. Then you push them to get more specific. Okay, so how would you tell the difference between JIA and a reactive arthritis? Now they have to compare and contrast. And finally, you get to the why. Walk me through your thought process for ordering that next test. It's not just about what they're doing, it's about them explaining the clinical reasoning behind it. So important. So, you've got the 5 steps, you've seen it in action. Let's talk about a few advanced moves that can take your Socratic teaching from pretty good to really, really great. I know this sounds completely backward, especially in a fast-paced setting, but honestly, one of your most powerful tools is silence. After you ask a great question, your best next move is often to do nothing. Just wait. That silence is where the thinking actually happens. Seriously, try to wait for at least 5 to 10 seconds. I know, it's going to feel like an eternity, but it gives the learner a chance to actually process the question and come up with a real thought instead of just blurting out the first thing that pops into their head. And this is especially important for your more introverted learners who need that time to think before they speak. You can also get really intentional with the kind of questions you ask. Think of this table as a ladder for your questions. Are you asking simple recall questions down at the remember level? Or are you pushing your learners up the ladder, asking them to analyze options, evaluate their choices, or even create a whole new plan for a complex patient? That's how you build real expert level thinking. And when you boil it all down, it really comes back to this fundamental shift in how you see yourself as a teacher. You're moving away from being the encyclopedia, the source of all facts, and you're becoming the guide, the person who helps the learner find their own way. So I'll just leave you with this one final thought, a challenge really. Thinking about everything we've talked about, what's the one question you're going to ask a learner tomorrow that's designed to guide their thinking instead of just telling them an answer? Because trying it out, even just once, is the most important step you can take.